Imagine sitting in a doctor's office, hearing three letters that suddenly change everything. CKD. Chronic kidney disease. In that single moment, the world around you seems to slow down. The walls feel like they are closing in, and every fear you have ever carried about your health rushes to the surface all at once. Your mind races. You think about your family, your future, the plans you made, the dreams you have not yet lived. You wonder whether any of it is still possible. You wonder whether the life you imagined is now behind you rather than ahead of you. And if that is where you are standing right now, or if someone you love is carrying that weight, then this video was made for you. Because what you are about to hear may completely change the way you see your diagnosis, your future, and your own strength. The first thing you need to understand is that fear is not your enemy. Fear is simply a signal. It is your mind's way of telling you that something matters deeply to you, that your life has value, that your future is worth fighting for. The problem is not the fear itself. The problem is what happens when fear becomes the loudest voice in the room, when it drowns out every other possibility, when it convinces you that a diagnosis is the same as a verdict. It is not. A diagnosis is information. It is a beginning, not an ending. And the sooner you are able to hold that truth in your hands, the sooner you will be able to move from a place of panic into a place of power. Millions of people around the world are living with chronic kidney disease right now. According to global health data, CKD affects approximately 10% of the world's population. That is nearly 850 million people. And yet, the majority of conversations around this condition are still dominated by worst-case scenarios, frightening statistics pulled out of context, and a language of hopelessness that does not reflect the full and honest picture of what modern medicine and modern living actually make possible. You deserve better than that. You deserve the truth, not the frightening half-truth, not the incomplete statistic, but the complete, honest, and empowering reality of what a CKD diagnosis actually means in today's world. Here is something that nobody tells you when you first receive that diagnosis. The human body is extraordinary. It is not fragile. It is resilient in ways that science is still working to fully understand. The kidneys themselves are among the most adaptive organs in the human body. In the early and middle stages of CKD, many people live full, active, and deeply meaningful lives. They raise families. They build careers. They travel, they laugh, they love, and they contribute. They do not spend their days defined by a medical label. They spend their days defined by their choices, their habits, their relationships, and their will to keep going. And that will, that quiet and unshakable determination to live fully, is something that no statistic can ever measure. The story of CKD is not a single story. It is millions of individual stories, each shaped by a unique combination of factors. How early the condition is detected, how carefully it is managed, what lifestyle choices are made, what support systems are in place, and how deeply a person believes in their own capacity to adapt and to thrive. The numbers that tend to dominate internet searches do not tell the whole story. They reflect averages across enormously diverse populations, and averages, by definition, cannot capture your story. They cannot account for your determination. They cannot measure your willingness to show up every single day and do what needs to be done. They cannot quantify the power of knowledge, of early action, of the kind of informed and proactive care that genuinely changes long-term outcomes. So before you allow fear to write the next chapter of your life, pause, breathe, and keep watching, because the information ahead of you in this video has the potential to shift not just how you think about CKD, but how you think about yourself and the extraordinary life that is still very much within your reach. Now here is where the conversation gets deeply important. And if you have ever searched for CKD survival statistics online, you already know how quickly that search can spiral into something terrifying. You type in a few words, and within seconds, you're staring at numbers that seem to strip away every ounce of hope you were holding on to. 5-year survival rates, dialysis timelines, kidney failure projections. The language is cold, the numbers are stark, and the context is almost always missing. And that missing context is everything. Because here is the truth that the raw statistics alone will never show you. The landscape of CKD management has changed dramatically over the past 2 decades, and the data that once defined expectations for kidney disease patients no longer tells the complete story of what is possible today. The question is not simply how long someone with CKD can live. The real question, the one that actually matters, is how well, how fully, and how meaningfully that life can be lived. And that question has a far more hopeful answer than most people ever get to hear. Let us talk about what the survival data actually shows when it is read honestly and completely. CKD is classified into 5 stages, based on how well the kidneys are filtering waste from the blood, a measurement known as the glomerular filtration rate, or GFR. In stages 1 and 2, kidney function is only mildly reduced, and with proper management, many patients in these stages live for decades without ever progressing to kidney failure. In stage 3, which is further divided into 3A and 3B, the condition requires more careful monitoring and lifestyle adjustment, but progression is far from inevitable. Studies consistently show that a significant proportion of stage 3 patients, particularly those who manage blood pressure, control blood sugar if diabetic, follow a kidney-friendly diet, and engage in regular physical activity, maintain stable kidney function for many years. Even in stages 4 and 5, where the condition is more advanced and the stakes are higher, modern nephrology offers tools, treatments, and interventions that were simply not available to previous generations of patients. This is precisely where the work and philosophy of those who have dedicated their lives to kidney disease research becomes so profoundly important. The insights and clinical frameworks shared by Dr. Matthew R. Weir, whose decades of research in nephrology and hypertension management have influenced how physicians around the world approach CKD care, remind us again and again that outcomes are not fixed, they are shaped. They are influenced by the quality of care, the consistency of management, and the active participation of the patient in their own health journey. Dr. Matthew R. Weir's contributions to understanding how blood pressure control directly impacts kidney disease progression have helped shift the entire conversation, from one of passive acceptance to one of active and informed intervention. That shift is not just academic, it is deeply personal for every single patient who has ever been told that their condition will simply worsen over time, because it challenges that assumption at its very foundation. And now, here is the moment of suspense, the part of this conversation that very few people ever reach, because most stop reading, most stop watching, most allow the fear to close the door before they ever discover what is on the other side. What if the most dangerous thing about a CKD diagnosis is not the disease itself, but the belief that nothing you do will make a difference? What if the data, the real, complete, and properly contextualized data, actually supports the opposite conclusion? What if the research consistently shows that the patients who engage, who ask questions, who adjust their habits, who build strong relationships with their healthcare teams, and who refuse to be defined by a worst-case projection, genuinely and measurably outperform the averages that frighten them in the first place? Because that is exactly what the evidence suggests. The gap between the patients who thrive and the patients who struggle is not always found in the severity of their diagnosis. Very often, it is found in the depth of their engagement with that diagnosis. And that is something you have the power to change starting today. So let us bring everything together, because this is the part of the conversation where fear finally gives way to something far more powerful, far more sustainable, and far more true. Everything you have heard so far has been building toward this single, essential understanding. You are not a statistic. You are not a stage number on a medical chart. You are not the average outcome of a population study conducted on people whose names, stories, habits, and hearts were never fully captured in any dataset. You are a living, breathing, choosing human being, and the choices you make from this point forward carry more weight than any number printed on a lab report ever could. That is not wishful thinking. That is not the kind of empty comfort that gets offered to people simply to make them feel better in a difficult moment. That is the honest, evidence-based conclusion that emerges when you read the full body of research with open eyes and a willing mind. The data does not just show us how people decline. It shows us, powerfully and repeatedly, how people persist, adapt, and in many cases, defy every expectation that was placed upon them. The foundation of that persistence is knowledge. Not the kind of knowledge that paralyzes you with information overload, but the kind that equips you. The kind that helps you walk into every medical appointment with the right questions. Understand what your lab results are actually telling you. Recognize the early warning signs that deserve attention, and make daily choices that consistently support your kidney health rather than quietly undermining it. Knowledge about the role of hydration, knowledge about which foods place unnecessary strain on already stressed kidneys, and which foods actively support their function. Knowledge about the critical relationship between blood pressure control and kidney disease progression, a relationship that research has illuminated so clearly that managing hypertension is now considered one of the single most impactful things a CKD patient can do to slow the progression of their condition. Knowledge about the value of regular physical activity, not as a punishment or an obligation, but as one of the most accessible and powerful tools available to anyone who wants to support their long-term health and vitality. These are not abstract recommendations. They are practical, proven, and within reach for the vast majority of people living with CKD today. And beyond knowledge, the foundation of a meaningful life with CKD is community. The understanding that you do not have to carry this alone. There are millions of people walking a similar path, and the collective wisdom of that community, combined with the guidance of compassionate and well-informed healthcare professionals, creates a support system that is genuinely life-changing. Find your people. Build your team. Stay connected to sources of information that treat you as an intelligent adult capable of understanding your own condition and making informed decisions about your own life. Seek out the kind of education that empowers rather than frightens, that opens doors rather than closing them, that reminds you consistently that the story of your health is still being written and that you hold the pen. The insights drawn from the lifetime of work contributed by researchers and clinicians like Dr. Matthew R. Weir exist precisely for this purpose, not to sit in academic journals accessible only to specialists, but to filter down into the lives of real patients, in real circumstances, facing real fears, and to light a path forward that is grounded in science, shaped by compassion, and alive with genuine possibility. You came to this video perhaps carrying fear, perhaps carrying confusion, perhaps carrying the quiet and exhausting weight of uncertainty about what the future holds. And if this video has done what it was intended to do, you are leaving it carrying something different: clarity, perspective, and the kind of grounded hope that does not ask you to ignore reality, but invites you to see it more completely and more honestly than you did before. Your diagnosis is not your destination. It is simply the road you are on, and the road ahead is longer, fuller, and more worth traveling than you may have dared to believe. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.